Good afternoon. Thank you all for joining us for Congresswoman Sherrill's Medicare Open Enrollment Webinar. We apologize she was unable to join in person today, but we have a great program planned. My name is Chris Williams. I work in Congresswoman Sherrill's Parsippany office, and I will be your host for this program. We're excited to share information with you regarding the open enrollment process, which is open now and ends on December 7th. This year, Congresswoman Sherrill is also excited about some new changes coming to Medicare that were included in the Inflation Reduction Act. Since she's been in office, lowering the cost of healthcare has been a huge priority, and we're excited to share some important updates with you all. I just want to cover a few things before we begin. If you have a question, please use the chat box on your screen. Our staff will be reviewing these throughout the event, and we will have time at the end for Q&A. Please keep in mind this is being recorded, and we will post it on our YouTube channel. So please refrain from disclosing any personal information with your questions, anything that we wouldn't be able to anything our panelists wouldn't be able to address live. If your question is more personal in nature, please contact our office, and we're happy to work with you offline to get you an answer. We'll get to as many questions as time allows, and if for any reason we're unable to get to you, we're happy to follow up with you afterwards. We'll share copies of the slides you'll see today, along with some other helpful resources that the agency's provided. And as I mentioned, this will also be posted to our YouTube channel. So with that, I'm going to turn it over to our panelists. So joining us today are Jarita Walker from the Social Security Administration. She's going to cover Medicare Parts A and B. After that, we'll hear from Adine Zephyrin from the Center for Medicare and Medicaid Services, who will cover Parts C and D. And lastly, Dara Cass is here from from HHS. She's going to walk us through the Medicare provisions included in the Inflation Reduction Act. So with that, I will hand it over to Jarita. If you'll give me a moment, I'm going to share my screen here, and we'll get into the presentation.
Thank you. Just let me know when you're there, and I'll start talking.
Okay, Jarita, the floor is yours.
Okay. Greetings, everyone. My name is Jarita Walker. I'm a public affairs specialist from the Jersey City Field Office, and I conduct outreach for Northern New Jersey. I would like to thank Congresswoman Sherrill's office and Chris Williams for allowing SSA to present to you all today. The presentation will cover Medicare enrollment, and some SSA resources will be shared with you after the presentation. I'm going to move on to the next slide entitled Medicare.gov. You let me know when you're there, and I'll continue to talk.
Go ahead, Jarita.
Okay. Center for Medicare and Medicaid Services, commonly referred to as CMS, administers the Medicare program. CMS is your main source for information regarding Medicare. Social Security helps you apply for Medicare's Part A and B, and we send your entitlement information electronically to CMS. We can also take your application for extra help with Medicare Part D. If you sign up for Part B, we deduct the premium from your monthly Social Security benefit and send it to CMS before you receive your payment from us each month. If you enroll in Medicare only, CMS will bill you for the Medicare Part B premiums until you go on Social Security. If you have any questions regarding the Medicare program, you can always call CMS at 1-800-MEDICARE or 1-800-633-4227. TTY users can call 1-877-486-2048 or visit Medicare.gov. I'm going to move on to the next slide entitled Medicare. Can I start talking?
Jarita. Yep.
Okay. Medicare is our country's health insurance program for people age 65 or older. People younger than age 65 with certain disabilities or permanent kidney failure or amyotrophic lateral sclerosis, which is Lou Gehrig's disease, can also qualify for Medicare. You have choices for how you get Medicare coverage, which is Original Medicare and Medicare Advantage. Original Medicare includes hospital coverage, which is Part A, and medical coverage, which is Part B. If you want drug coverage, you can add a separate drug plan, which is Part D. You can also add Medicare supplement insurance, which is the Medigap policy, to help pay your out-of-pocket costs. Medicare has 4 parts. First, Part A, hospital insurance, which covers most inpatient hospital expenses. The 2023 deductible for Part A is $1,600. Second, Part B, medical insurance, which covers 80% of doctor bills and other outpatient medical expenses after your first $226 in approved charges. The 2023 standard monthly premium is $164.90. There is no monthly premium for Part A if you are insured for retirement benefits. After you retire, your health insurance may require for Medicare to pay first. Many supplemental plans require you to sign up for Medicare Part B. The Medicare premium most beneficiaries pay represents a quarter of the actual cost, and the federal government covers the balance of the cost. Third is the Medicare Advantage, also known as Part C. It's an all-in-one alternative to original Medicare. These bundle plans include Part A, Part B, and usually Part D. These plans may also have lower out-of-pocket costs and may offer extra benefits that original Medicare does not cover, like vision, dental, and more. Lastly, Part D, the Medicare prescription drug coverage, which covers a major portion of your prescription drug costs. Your out-of-pocket costs, monthly premiums, annual deductible, and prescription co-payments will vary by plan. You enroll with a Medicare-approved prescription drug provider, not by contacting Social Security. Each Medicare Advantage plan can charge different out-of-pocket costs, but they must follow rules established by Medicare. Medicare-approved prescription drug plans cover a major portion of your prescription drug costs. I'm going to move on to the next slide entitled Medicare Eligibility. Let me know when you're there, and I'll continue.
Go ahead.
Medicare eligibility begins at age 65, even though the full retirement age has increased above age 65. One of the most important things to remember is that you can apply for Medicare online, even if you are waiting past age 65 to apply for Social Security retirement benefits. You should apply for Medicare 3 months before your 65th birthday, even when you plan to apply for retirement or spouse's benefits later. If you are approved for Social Security disability benefits, you will be eligible for Medicare benefits 24 months from the month you were entitled to receive benefits, not from the first month you receive a payment. If you are diagnosed with amyotrophic lateral sclerosis, which is Lou Gehrig's disease, and you get disability benefits, you can get Medicare right away. And if you have permanent kidney failure and you receive maintenance dialysis or have a kidney transplant, you may also be eligible for Medicare. I'm going to move on to the next slide entitled Medicare Part B Coverage, IEP. Let me know when you're there, and I'll continue.
Go ahead.
Okay, initial enrollment period. This is a 7-month period that begins 3 months before your 65th birthday, includes the month you turn age 65, and ends 3 months after that birthday. If you apply during the 3-month window prior to the month you turn age 65, your Medicare is effective on the first day of the month you reach age 65. If you sign up during the last 3 months of the initial enrollment period, your coverage begins the month after you enroll. I'm going to move on to the next slide entitled Medicare Part B Coverage, GEP. Let me know when you're there.
Go ahead.
If you choose, and this is the general enrollment period, if you choose not to sign up for Medicare Part B, but then decide to do so later, your coverage could be delayed. You may have to pay a higher monthly premium for as long as you have Part B. Your monthly premium will go up 10% for each 12-month period you were eligible for Part B, but did not sign up for it. If you do not sign up for Medicare Part B during your initial enrollment period, you have another chance each year to sign up during the general enrollment period, which begins January 1st through March 31st. Your coverage starts the first day of the month after you sign up. I'm going to move on to the next slide entitled Medicare Part B Coverage, SEP. Let me know when you're there.
Go ahead.
Special enrollment period. You may have medical insurance coverage under a group health plan based on you or your spouse's current employment. In this case, you may not need to apply for Medicare Part B at age 65 you may qualify for a special enrollment period. If you apply online for Medicare Part A only and refuse Part B, which does have a monthly premium, you can enroll in Part B later. Anytime you are still covered by your employer's group health plan or within 8 months after your coverage or employment ends. Effective January 2023, there are 5 new special enrollment period categories due to exceptional conditions. First, individuals impacted by emergency or disaster. Second, misrepresentation by a group health plan or an employer. Third, anyone who was formerly incarcerated. Fourth, termination of Medicaid coverage. And fifth, other exceptional conditions. Remember, you can file for Medicare if you are delaying cash benefits. I'm going to move on to the next slide entitled Medicare Applications. Let me know when you're there.
Go ahead.
If you are already enrolled in Medicare Part A and later you want to add Part B under the special enrollment period, you have 3 options. You can visit our website at ssa.gov/benefits/Medicare to complete the online application, or you can also fax your completed CMS 40B application for enrollment in Medicare Part B for medical insurance and CMS L564 request for employment information and proofs to your local Social Security office. Lastly, you can also mail your completed forms to your local Social Security office. The 2 forms are available on our homepage and will be shared with you after the presentation. I'm going to move on to the next slide entitled Extra Help with Medicare Prescription Drug Plan Costs. Let me know when you're there.
Go ahead.
Extra help is available for beneficiaries with limited resources and income to help pay for the costs related to Medicare prescription drug plans. These costs include monthly premiums, annual deductibles, and prescription co-payment. Extra help is estimated to be worth about $5,300 per year. You may apply for extra help online, over the phone, or in your local Social Security office. I'm going to move on to the next slide entitled Medicare Savings Program, MSP. Let me know when you're there.
Go ahead.
You may be able to get help from your state paying for Medicare Part A hospital insurance and Part B medical insurance premiums through a Medicare Savings Program. If you qualify, Medicare Savings Programs might also pay your Part A and Part B deductibles, coinsurance, and co-payments. In many cases, to qualify for a Medicare Savings Program, you must have income and resources below a certain limit. There are 4 Medicare Savings Programs. First, Qualified Medicare Beneficiary Program, which is the QMB. Second, Specified Low-Income Medicare Beneficiary Program, which is the SLMB. Third, Qualifying Individual Program, which is the QI. And last but not least, the Qualified Disabled and Working Individual Program, which is the QDWI. You can apply for Medicare Savings Programs through your state. When you apply, your state determines which programs you qualify for. Even if you don't think you qualify, you should still apply. I'm going to move on to the next slide entitled Medicare Standard Part B Premiums for 2023. Let me know when you're there.
Go right ahead.
Okay. This graphic shows the Medicare premiums for each income bracket. Medicare beneficiaries pay the standard premium for Part B, which is $164.90 a month in 2023. It is automatically deducted from their Social Security check if they receive one. If not getting a check, they can be billed or have the premium deducted from a checking or savings account. People with higher incomes will pay more for Part B and their prescription drug plan premium. This is called IRMA, Income-Related Monthly Adjustment Amount. We determine whether you pay the higher premium every year. To decide your IRMA, we ask IRS for your modified adjusted gross income, which is the MAGI. That equals your adjusted gross income plus certain tax-exempt income from the federal income tax return you filed 2 years ago. For example, Your 2023 Part B premium is determined by your MAGI on your 2021 return. If your 2021 tax return is not available, we will use your 2020 tax return. You should not contribute to a health savings account if you are enrolled in Medicare, as there may be negative tax implications. Contact your tax professional for more information. I'm going to move on to the next slide entitled, A Qualifying Life-Changing Event May Reduce Monthly Part B and D Premiums. Let me know when you're ready.
Go right ahead.
If you are a higher income Medicare beneficiary, but you have had a major life-changing event, for example, you stop working, or you have reduced your work, or your income has decreased, you may ask Social Security to make a new determination on your premium. Use Form SSA 44 and provide proof of the life-changing event. I'm going to move on to the next slide entitled Medicare.gov. Let me know when you're there.
Go ahead.
Medicare has a free, secure online service for accessing personalized information about your Medicare benefits and services with a Medicare.gov account. It is available at Medicare.gov. After you create an account, you can fill out the initial enrollment questionnaire, view claims information, get quality information about your providers, and more. For more information or help with the site, please contact the Center for Medicare and Medicaid Services at 1-800-MEDICARE, which is 1-800-633-4227. I'm going to move on to the next slide entitled Disclaimer. Let me know when you're ready.
Go ahead.
Please visit the website for up-to-date information on our programs and services. SSA will keep adding content and encourage you to conduct business online. I'm going to move on to the next slide, which is me.
Go ahead.
Here is my contact information. Please contact me if you need assistance with any SSA matters. And last but not least, the next slide is the Q&A session, which I know you said we'll hold off on for later, but I just want to close out with. This concludes the presentation for today. I hope you found the information to be helpful. And thank you, Congresswoman Sherrill's office and Chris Williams, for allowing me to present to you all today. Thank you.
Thanks, Drita. That was great information. We appreciate that, and we appreciate you sticking around at the end for some questions as well. I do see some folks that use the raise hand button. Unfortunately, we're not able to bring anyone live today. So if you have a question, please use that Q&A box at the bottom of your screen. Next, we will hear from the Center for Medicare Medicaid Services. We have Adine Zephyrin with us today, and I will hand it over to her as soon as I pull up her slides. Give me a second. Okay, Dean, the floor is yours.
All right, thank you so much, Chris. As Chris says, we're going to go directly to the second slide, Chris. As Chris says, my name is Adine Zephyrin. I'm an outreach specialist with the Centers for Medicare and Medicaid Services. Before I start, I definitely want to thank Congresswoman Sherrill for inviting CMS to talk to you today. We're going to the next one. Thank you. That's just the disclaimer, just as Jarita just told you. This is basically saying that everything that I'm going to be telling you right now is current as of today, but things do change, rules, regulations, the laws, they do change. But as of today, everything that I'm going to tell you is current. And the next slide. Thank you. So every year you have the opportunity to review and compare your plan choices and pick the coverage that's best for you. During the open enrollment period, which started on October 15 and it's going to end on December 7. You can join or switch a Medicare prescription drug plan. You can also join and switch a Medicare Advantage plan you can leave a Medicare Advantage plan and return to coverage on the original Medicare. And during the open enrollment that ends on December 7, that gives you 7 weeks to make your decisions, to compare and find the plans that is best for you, either original Medicare or a Medicare Advantage plan. Next. Each year, Medicare plans can change what they cost and they cover. They must inform you of the coverage and changes each year. We mail the Medicare NU handbook to every single Medicare beneficiary so that you can take a look way before October 15th. The plans also must mail you or provide electronically, if this is what you chose, what is called an annual notice of change. And the annual notice of change that includes changes in the coverage, in the cost, in the service area that's going to be effective January 1st of 2024. The annual notice of change also gives details about the plan coverage and the cost and any other changes that entails. And more importantly, some plans do choose to leave the Medicare program. So it's very important that you pay attention to your mail or your email if you choose electronically to find out if your plan is still participating in the Medicare program. Next. What are the things to consider? There are important differences between coverage options. Before making any changes, you should consider certain things. One of them is the cost. In original Medicare, as Jarita just said, it is very simple. Medicare Part B, with Medicare pays 80%, you're in charge of the other 20%. Part A, you don't, some of you pay premium, some of you don't pay premium. That's for the hospital. So that's the cost. Whereas for Medicare Advantage plans, that you have a premium in addition to the premium that you pay for Medicare. You can also have a premium for the plan. It also have usually what is called a yearly limit on your out-of-pocket costs. Whereas for original Medicare, there is no limit at all. If you join a Medicare Advantage plan, once you reach that limit, usually you pay nothing for covered services for the rest of the year. The next thing you should consider is the coverage. Original Medicare covers medical services and supplies in hospitals, in doctors' offices, or the healthcare settings. Services are either covered under Part A or Part B. Whereas for Medicare Advantage plans, also called Part C, for Medicare Advantage plans, they cover all of the services that original Medicare covers, but also some of them may offer benefits that original Medicare doesn't cover. Dental is one of them, vision is one of them, hearing is another one of them. So those are the stuff, the information you need to remember when you're making your choices. There is also supplemental coverage. Jarita briefly mentioned Medigap. So what is Medigap? Medigap is exactly as it says. It's something that fills in the gap if you have original Medicare only. Medigap doesn't go with Medicare Advantage. It doesn't go with Medicare Part C. It's only for original Medicare. If you have original Medicare, you can purchase a Medigap policy and that fills in the gap. The prescription drug, also Part D, in original Medicare, you'll need to join a plan to buy your prescription drugs. Whereas some Medicare Advantage plans might include drug coverage. Your doctors and hospital choices in original Medicare, you can go to any doctor that accepts Medicare. Whereas on the Medicare Advantage plan, usually has to participate, you usually have to choose doctors and facilities that are part of your network, of the plans network. The quality of care, in original Medicare, you can get a snapshot of the quality of care on our website, compare.gov. Whereas for Medicare Advantage, the plan usually will be telling you about that. The last thing we should be talking about that's always important is travel. Some of you travel, so always keep in mind that original Medicare generally doesn't cover care outside of the United States. You may be able to buy supplemental insurance that offers that. Whereas from Medicare Advantage plans, they also usually don't cover care you get outside of the US. So if you are somebody who likes to travel, be very careful about, if you have original Medicare, you already know. But if it's an MA plan, find out. Some don't cover, but some might cover it. So you find out from the plan. And that's also something to consider when you're making your choices. The next slide, please. If you have other coverage, like for instance, employer coverage, union coverage, check with your plan's benefits administrator before making any changes to your coverage. That's very important. Otherwise, you could lose coverage for you and your dependents. So find out first before you make that choice. Next slide. We really want you to be satisfied once you get Medicare. So the Medicare Open Enrollment period gives you the chance to do all that. You can research, you can compare, and you can choose original Medicare or Medicare Advantage plan. You can also choose the prescription drug plan that is right for you. So some of the ways that you can do that is, as I mentioned before, we mail you, every single one of you, the Medicare NU handbook. Take a look at it. You can also you take a look at the annual notice of change that you get from your plan. You can absolutely contact your SHIP, and SHIP stands for State Health Insurance Assistance Program. They are wonderful. We train them, so they are very knowledgeable. You can contact them directly and find out, make an appointment, and they will sit down with you and they will go over all that. You can also visit our website, medicare.gov /plan compare. So you go there and you can compare plans to make sure that whichever plan you choose, that is the right one for you. And you can, of course, review the Medicare Health and Drug Plans website. Those are all this, everything that you can do before you make your choices, so that come January 1st, you are satisfied with choices. Next slide, please. How do you join a new plan? There are several different ways that you can enroll in a Medicare health plan or a drug plan. You can call the plan directly if you already know exactly what plan you want to choose. You can enroll on the plan's website, or you can again go to our website, medicare.gov plan compare. Once you choose that plan, right then and there, you can go ahead and enroll there. You can always call 1-800-MEDICARE. And again, that's 800-633-4227. You can also complete and mail a paper application. You can to enroll in a Medicare Advantage plan. These are all the ways that you can join a new plan. Next, Chris. How do you get information and help during that open enrollment period? Again, that ends on December 7th. So you still have some time, but it is definitely, if you haven't started yet, you should absolutely get started. If you're calling 1-800-MEDICARE, or you go and sit down with one of our SHIP counselors, for New Jersey, you can call 1-800-792-88 That's for New Jersey. You can call that number and you will get in contact with a SHIP counselor that will be more than happy to make an appointment to sit down in person and help you navigate the open enrollment period. What do you need to have with you? You should know your zip code, of course. If you have, if you take, if you have medications, make sure you have a list of the prescription drugs and their dosage with you. You should also know your pharmacy preferences, which ones are closest to you, for instance. You should definitely, if you have a lagging information for your Medicare account, you should also have that with you. So you should, of course, have your Medicare card with you. If you are part of a Medicare Advantage plan, make sure you have that card with you. If you have a drug plan, make sure you have that card with you. So basically, you have all this information with you, and then they can absolutely be more than happy to help you enroll in the plans that you need, if you're not satisfied completely with what you already have. The next slide. Jarita already covered original Medicare versus Medicare Advantage. And I also talked about the difference between the two. So what you should remember basically is that original Medicare, it's A and B, and the B is for your doctors. We cover 80%, you take 20%. Medicare Advantage, it's definitely completely different. Each plan has their own premium. The benefits that they offer will, of course, be the benefits that Medicare, original Medicare offer, plus whatever other benefits that they might offer. Let's remember that vision, dental, and hearing, original Medicare usually don't cover that. So Medicare Advantage, some of them cover it. So this is, if this is something that is important to you, definitely keep that in mind when you're making your choices. The next slide. What are some of the considerations you should have for a Medicare Advantage plan? So you should ask yourself some questions. How much is the premium going to be? What is the deductible going to be? What are other costs that's going to be part of that plan? How much do you pay for services like hospitals and doctors' visits? You should think about the network itself. If you have a doctor and you like your doctor, is your doctor part of that plan? That is all considerations that you should think about. Plans must cover all medically necessary services that original Medicare covers. So in many cases, you may need to get approval from your plan before it covers certain services or supplies. So find out what those are. Do your doctors accept the coverage? Are your doctors, the doctors you want to see, accepting new patients? Do you have to choose your hospital or healthcare providers from a network? Do you need to get referrals? Are you satisfied with your medical care, the quality of care? So these are all considerations that you should keep in mind when you're making your choices. Next slide. For Part D considerations, when we're talking about a drug plan, what are the considerations? Ask yourself, does the plan cover all the medications that I take? That's very important. Does the plan have restrictions on the drugs that you take? Does it need prior authorization? Does it need a step therapy? Does it have a quantity limit? How much will your monthly premiums be, plus the annual deductible, plus the copay? How much will I pay at the pharmacy for the copay and the coinsurance? Is the pharmacy in the plan's preferred network? What I mean by that is the pharmacy that you want to use might be close to you, but it might not be part of the plan's preferred network. So that's something you should consider. Can you fill your prescription by mail order? That's something you can consider. We also, under the plan compare, what we have what we call a star rating. So you might want to find out exactly what is the star rating of the plan that you want to choose. And if you have retiree coverage, will the Medicare drug plan work with this coverage? All these are considerations that you should have before making choices. Now, next one. The Medicare policy, we talked about it. Again, this is a policy in an insurance that helps fill the gaps in original Medicare only. It is very important to remember that if you have a Medicare Advantage plan, you do not need and you cannot buy a Medigap policy. Medigap only works with original Medicare. That's it. The next one. And these are all the resources that are available for you. You can go to Medicare.gov, CMS.gov. You can go to our plan compare at Medicare.gov. When Chris send that for you, please take a look and they will be able to help you. The last one, Chris, is so this is all for this is it for me, but we always appreciate your feedback. So if you can, we would definitely appreciate it if you do the evaluation. When you do, the only thing we ask is that you do call the activity CMS New York Medicare Open Enrollment. That is it for me, Chris. Thank you very much. And I will be taking your questions at the end.
Thank you so much, Dean. And last but not least, we are excited to share some important information on the Inflation Reduction Act with you. So with us today from the Department of Health and Human Services Regional Office is Dara Cass, and she has a slide here for you guys. Give me a moment. Okay, Dara, the floor is yours.
Awesome. Thank you so much, Chris. So first of all, I just wanted to say that normally I do this in person, and actually what you're seeing as a slide is actually a handout that we give out. On the back of the handout is the SHIP number, and I want to reiterate how important it is for you to call for personalized information during the open enrollment season. But the card that you're looking at right now actually just talks a little bit about the Inflation Reduction Act. And for those of you that haven't been paying attention, the Inflation Reduction Act was a remarkable piece of legislation that was passed at the end of 2022, effective 2023, that was signed into law by passed by it's a unipartisan piece of legislation, as I say. It was passed by the House and the Senate and signed by the president into law that actually comes and does a few remarkable things, including climate provisions and tax provisions, but also really affects Medicare and specifically Medicare Part D pricing for a lot of prescription drugs. And I just want to take a minute to talk a little bit about what has already gone into place for the law and what is coming, because as you look during open enrollment period at your Medicare plan and evaluate what is right for you, you may want to make sure that you incorporate some of the provisions that are coming into place for Medicare under the Inflation Reduction Act, so you know what other benefits you had that you hadn't had in the past. So one of the ones we talk about a lot is $35 insulin. So for any Medicare beneficiary, and in New Jersey, there are 40,000 seniors who are on Medicare who are on insulin. And if you are on a covered insulin, it is $35 per month per prescription. And this is pretty meaningful to seniors that are on insulin who are also on Medicare. You should know that if you're a diabetic senior who is on other medications, there are many, many other parts of this law that will affect your treatment, not just related to insulin. But the insulin provision has already gone into place and is not just extraordinarily popular and easy to understand, really important to ensure that seniors who need insulin are not making sure they're not having to choose between putting food on their table and paying for their insulin, or making sure that they're not having to choose between their rent and their medication, because we know that ensuring that your sugar is well covered and that is critically important to all your other medical conditions. The other part of this that's got into place, which is really important, is the free vaccines. So often I'll be in a room with senior citizens and I'll talk about the shingles vaccine, and I'll ask in a room, and there are 162 of you here, and unfortunately you can't raise your hands. I'll say, how many of you have gotten the shingles vaccine? And there'll be, I don't know, 25 to 30% of the room will raise their hands. And I'll ask if you can keep your hand up if you paid more than $5 for the vaccine. And there will be a certain number of hands in the room, and eventually I'll get to the senior that's paid $200 or $250 for the shingles vaccine. And other seniors in the room will be surprised because many of you were fortunate enough not to be paying for the shingles vaccine amongst your other preventative vaccines. But seniors in the United States have been paying hundreds of dollars for vaccinations, and that is going to end now already with the Inflation Reduction Act. So it covers all preventative vaccines, which includes shingles and tetanus, which covers whooping cough if you need to get your whooping cough vaccine if you have a grandchild. It covers COVID, so it's remember that it's a good time to get your updated COVID vaccine in time for the winter, and flu. And RSV and pneumonia and any other vaccine that is considered preventative as recommended would be covered under the Inflation Reduction Act. And we just like to give you a heads up that coming in 2025 and 2026 are some remarkable parts of this law, which include a out-of-pocket maximum cap on prescription drugs for seniors. Now, this is very, very exciting. What it means is that over the cost of prescription drug payments, your out-of-pocket costs will end at $2,000 a year. And that means once you've spent $2,000 out of pocket, you're not going to be spending any more money. And we know based on the coverage currently between all the different phases, the initial phase, the deductible phase, and then the coverage phase, and then there's a catastrophic phase all the way at the end, and a coverage gap in the middle. Seniors can really have a complicated time understanding how much each of their prescription drugs is going to cost them over a period of time. So starting in 2025, that ends at $2,000 annually. There also are parts of this law that add to the extra help, like we've heard about, and also add to the subsidies under the Affordable Care Act. So remember that many of you are on Medicaid. Some of you may also be on Medicaid. I'm sorry, many of you are on Medicare, but some of you may also be on Medicaid, which may mean that you get benefits under Medicaid, and you need to make sure that you are also keeping your information up to date to make sure you don't lose your Medicaid benefits as well. And then there is help here, obviously, for people under the exchange for premiums if somebody is getting marketplace coverage. But I don't want to confuse too much. I just wanted to cover some of the basic provisions in the Inflation Reduction Act that's already gone into place. Most specifically, like I said, the $35 insulin, the covered vaccines, let you know that the $2,000 out-of-pocket premiums are coming in 2025. And the last thing is the negotiated drugs that's starting in 2026, although we're negotiating them right now. So we're very excited about the Inflation Reduction Act. It is an incredible piece of legislation that really will advocate to contain costs for seniors under prescription drug coverage. And it's really important that you know this as you evaluate your Part D coverage and whether or not which plan is right for you. So I'm going to hand it back for you, Chris, and let you go from there to answer any questions.
Thank you so much, Dana. We're also very excited about the Inflation Reduction Act. As you mentioned, some of it's already going into place in the next few years. We should see some more exciting help go out to folks in this area. So I really appreciate you walking us through that. We have until about 3 p.m. So we have a time for questions here. We got a good amount, and we're going to try to get to as many as we can. A few of these covered similar topics, so I'll try not to repeat everything. But obviously, this is a really important topic, and we want to make sure we get anything clarified. We threw a lot of information at you. So let's see here. Few questions on Part A and B coverage and when folks should sign up. So Jarita, if I could have you available here.
Yes.
Let's see, first we have George. He signed up for Part B, but has coverage through his wife's employer. Can I change Medicare coverage and delete Part B?
As long as your wife is still working, I recommend that you stay under your wife's coverage. This way you don't have to pay for the Part B premiums. When your wife decides to retire, have you both submit special enrollment forms, which will be shared with you after the presentation. One form is going to need to be completed by your wife's personnel department, letting Social Security know when she started working, when she's going to stop working, when her coverage began, and when her coverage is going to end. And then the other form, which is the CMS 40B, that is the form that both of you complete, letting Social Security know what month you want Medicare to begin, which should be the month after your wife stops working. So hopefully this will be helpful to you, but after the presentation, the forms will be shared with you, so to make it easier for you when it comes time for her to stop working and for your Medicare Part B premiums to begin. Hopefully that was helpful.
Thanks, Jarita. And you also answered Anthony's question, who was wondering about the forms. So I know we have those,
Okay.
and we'll share them afterwards. So thank you. Staying on that topic, we have an anonymous question. The speaker mentioned we should not be enrolled in an employer-sponsored HSA plan before filing for Part B. What is the time period between leaving the HSA plan and enrolling in Part B?
Now that, as I stated in my presentation, when it comes to health savings plans, you need to contact your tax person for that. So that's not my area of expertise, but that is who I would refer you to when it comes to that topic of health savings plans. You can, like I stated before, you should not contribute to the health savings account if you are enrolled in Medicare, as there may be negative tax implications, but contact your tax professional for more information, if that's helpful.
Thank you. And I know we covered this, Jarita, but we have a couple questions on this in here. And if you could clarify it, would be much appreciated, because we get questions on this when it's too late. So we have a husband and wife who enrolled in Medicare. We both enrolled in Part A at age 65. Do we have to sign up for Part B at this time? And is there a penalty if we haven't?
Yes. If neither of you are still working and have employer group health plan coverage, it is strongly recommended that you enroll in Part B. I do not want you to incur a penalty. So if you miss your initial enrollment period and you're not eligible under the special enrollment period, which means you're refusing to take it at 65 because you're both still working and have coverage either through your employer or your spouse's employer, this way no penalty will be applied. But if that is not the situation, please enroll when you turn 65. Because if you don't, and say a year or two later, if next year you're 66 or the year after that you're 67, they charge you a 10% penalty for each 12-month period that you do not take it. And whatever the premium is that year, they'll incur that 10% premium. So next year's premium is $174 and change, if I'm not mistaken, it's $10 more. So if you miss next year, and it'll be 10% added to the $174.90. And that's what I do not want you to incur. So if you're still working and have coverage through your employer, you do not have to enroll in the Part B until you're going to retire. But if you are not still working and do not have coverage with your current employer, I strongly recommend that you enroll in Part B, so this way you do not incur any penalties. Hoping that'll help.
Thank you for making that clear. And please, if you have any questions on that, please follow up with us or one of the speakers, and happy to make sure you have the right information there. Again, staying on Part A for the moment, I will be 65 in March and do not have enough credits to qualify for SSI or Medicare. Do I still have to make an application for Medicare Part A?
You can enroll, but just be mindful, if you don't have enough quarters of coverage to be insured to have Part A free, you're going to have to pay for it. And that's where you would need to look into Medicare's website. They have a chart that lets you know what the premiums are going to be if you're not insured for Part A and don't have enough quarters of coverage to be insured to get it free. So you can look at their website and they'll be able to let you know what how much Part A costs. You'll have to pay for it if you don't have enough quarters of coverage to be insured.
Great, thanks, Jarita. I see a few questions in here about the slides. We will absolutely share these with you guys on the back end. If you registered for this, we have your email and we'll get it out to the whole list. Next, we have a question from Karen. She receives NJPAAD. I believe that's the prescription drug benefit through the state. I don't know what to do for signing up for a drug plan that goes with NJPAAD. Do any of our panelists have any insight on how a prescription plan interacts with that program?
Adine, that'd be you.
Okay, so if that person is on Medicare and did not sign up for Part D because they have the state plan, what I would suggest is that if this meets all your needs, then by all means. But if it doesn't, you should definitely apply for Part D. Now, the only thing that Jorida and I did not mention is that Part D also anchors a late enrollment fee. So if you were eligible to apply for Part D, but you chose not to, unless you have what we call a creditable coverage, meaning that you have a coverage that is as good or better than the Medicare Part D, then you will incur a late enrollment fee. Now, your specific circumstances, I don't know. I can say you can call 1-800-Medicare, or you can contact one of the SHIP's counselors, and they can give you the specifics. But remember that it is important to remember that Part D also anchors a late enrollment fee, and we don't want you to anchor that fee. So that's what I would say about that.
Thank you. Our next question comes anonymously, and I will see if we have an answer to this. If not, I would like to follow with you on the back end and make sure we can point you in the right direction. But we have a retired state employee. This could be a teacher, a police officer, or someone down in Trenton. How do retired state employees apply for Medicare, and how does this affect pension payments? Do we continue with our current insurance as our secondary once we switch to Medicare? And again, if we don't have that answer on the on this panel, we can follow up with the state.
I was about to say.
Go ahead,
Go ahead. I was going to say, Adine, can you answer that one? I just want to be sure. I would need to know more information before I answer.
Okay, now when it comes to having coverage after you retire, again, it all depends on your age. If you're not 65 yet, then this is a moot point. But if you are 65, this is the part where you should definitely contact your plan to find out should you also apply for Medicare. And if you apply for Medicare, which one will be primary and which one will be secondary? But this is something that you should contact your plan and find out. And whatever they tell you, I would suggest strongly that you do that, because some plans will tell you, yes, as soon as you turn 65, you must apply for Medicare. Medicare will be primary, will become secondary. So that's what you should find out from the plan directly.
Yeah, from what we've learned over the years, if you have employer coverage, always good to check with the HR department. I think in this case, the Division of Pension and Benefits would be the agency you would need to speak to. So that one was submitted anonymously. So please feel free to give our office a call, and we will make sure you get connected there. Moving forward here. This is an interesting one. I think this will probably come up from a few folks. I've been advised by multiple social workers and hospital employees that Advantage programs are fine if you're healthy, but if you have a change of health or a serious crisis, you'll have a financial or care problems. I'm healthy, but as someone who's 80, I'm worried that I cannot change to traditional Medicare and a supplemental if necessary. Can we clarify how any of this feedback she's been given? I can repeat that if needed.
I think I understand the question. What I would say is that what we want you to do is to research and compare and find out what is best suited for you specifically. Original Medicare, I've covered what it covers, and then Medicare Advantage plans, I've the slides will tell you what are the considerations that you should have for original Medicare. So no one really can tell you which one is best for you. Only you can make that decision. When you look at both together, if you go into our website, medicare.gov or even cms.gov, you can take a look and see what original Medicare covers and then what a Medicare Advantage plan might cover. Then you look at both of them and you decide for you specifically which one will be best suited. But that is a decision that you only can make that.
And again, we'll share Dean's slides with everybody. And I believe she had one with some great resources where you can go to research plans and compare them. And we've got a few comments in here praising the SHIP counselors. We'll definitely include that info. There are great resources that we refer people to routinely. So we'll make sure that reaches everybody. Similar question, same topic, Dean. We have someone, I understand we can change from Medicare Advantage to original Medicare once early in the following year for sign up. I thought we could never go back to original Medicare once we decided to go with Medicare Advantage. Could you just clarify this? And Dean, do we have, is it official yet when the Medicare Advantage open enrollment period will be?
No, right now, one of my slides, let me see if I can find it, but right now is definitely the time that you can do that. Remember that during the open enrollment period, you can do that. You can switch you can join or switch a Medicare Advantage plan. You can leave a Medicare Advantage plan and return to original Medicare. Right now, you can do that up until December 7th, if this is what you want to do. But yes, you can do that during the open enrollment period. You can leave an MA plan and go back to original Medicare.
Okay, great. We have a couple questions on traveling and doctors in other states. If we can just cover a few of these. Of course, we have a lot of folks in the area that like to use doctors in New York. Is that possible? Can you go to doctors in other states like New York City?
Now, this is the part where we were talking about the difference between original Medicare and Medicare Advantage. Again, if you have original Medicare, you can see any provider in the United States of America as long as they take Medicare. We pay 80%, you pay 20%. That's original Medicare. Now, when you are part of a Medicare Advantage plan, the plan is what you need to follow. Some plans will tell you that the provider must be part of a network. The plan will also talk about a service area. When you're buying that plan, all this is what you need to, that's some of the considerations that we mentioned earlier. This is something that you should, if you're somebody who likes to travel, if you're somebody who doesn't stay home and always going traveling to different states, and you have a Medicare Advantage plan, then this is absolutely the part where you should consider looking at the plan, what they offer, how big is their network, do they allow you to see providers in different other states, and so on and so forth. That's for Medicare Advantage. But if it's original Medicare, it's as simple as that. If the provider takes Medicare, then you can see that provider. But if it's an MA plan, we cannot tell you because each plan has their own benefits that they offer. It's the plan that you need to contact directly, or you can look at their website and find out exactly what are the restrictions, what you can do, where you can go, what is the service area, and so on and so forth.
Appreciate that. Next question comes from Don. Is there any kind of penalty if you move from A and B to an Advantage plan and then back? Is there any penalty that comes from those switches?
I'm losing you, Chris.
Sorry, is there any kind of penalty if you move from Part A and B to an Advantage plan and then
if you
back?
can hear me, Chris, you're frozen right now. Maybe it's just me.
Yeah,
Sorry.
Edith, it's you. Chris is not frozen for me.
Okay. Then that was just me. I guess that's my internet connection. So I'm sorry, Chris. I can see you now. Go ahead,
Well,
ask the question again.
Sure. Is there any kind of penalty if you move from A and B to an Advantage plan and then back? Is there any penalty for switching?
No, there is no penalty at all. During the open enrollment period, again, this is why we have it every single year, and you have 7 weeks, so you can choose whatever suits you best. You can be in original Medicare and go to an MA plan, and you could be an MA plan and say, I'd rather go on original Medicare. You can do that. There is no penalty for that. Of course, you cannot do it at any time that you want throughout the year. During the open enrollment is when you can do that.
Okay, and we have time for one more question live here. Dara, if I can get your answer on this. Does the Inflation Reduction Act for immunizations include Medicare Advantage plans or only original Medicare?
So the answer is it covers everybody covered by Medicare. Many people on Advantage programs were already not paying for vaccines. They were already covered. So what this does, and this is actually the bottom line for the entire Inflation Reduction Act, is it elevates the floor to make sure that no senior, regardless of plan you're on, according to the basic coverage of Medicare, is paying for vaccines. So if you are on an Advantage program, you are likely not paying for a lot of these vaccines. But if you were for any reason, now you would not, because the requirement of Medicare is now that the vaccines are covered at no cost to you. And Chris, if you don't mind, there was another question asking me if the $2,000 out-of-pocket cost was for real. And I wanted to reiterate that it is actually for real. So yes, I agree with the woohoo that the $2,000 out-of-pocket cost, which is all of your out-of-pocket costs on prescription drugs covered by Medicare Part D, once you hit those $2,000 in 2025, you are done paying, which for me is one of the biggest senses of relief for senior citizens when they sometimes don't understand the unlimited costs that are potential if they're getting put on a medication that could continue to cost them money.
Thank you. And you read my mind. I was going to plug that question and comment at the end here. We're very excited about these provisions. So unfortunately, that is all the time we have today. You guys were a really great audience. We have a lot of questions and comments in here. So we're going to sift through those. If you left your name, we have your email and we'll follow up with you directly. But if you answered or left a question anonymously, please give our office a call and we'll follow up with you directly. Otherwise, we don't know who asked it. Our office number is 973-526-5668. Again, 973-526-5668. You can also go to sherrill.house.gov and submit a question through our website. We really appreciate all of our panelists joining us today. There's some really great information. I know we threw a lot of information at you, so look out for an email from me. That's going to have a lot of links and resources and attachments to it. And as you sift through this over the next couple of weeks and you have other questions, feel free to reach out to us. I know Adine and Jarita and Dara included contact information in there, so you'll get all that. And again, please use it as a resource. We hope everyone has a great month, have a great Thanksgiving, and we look forward to working with you soon. Take care.